Welcome to my second webinar, which is about isolation, transmission-based precaution, and PPE in the world of COVID-19. I want to welcome MSF staff and external partner into this session. And as there is some MSF staff from other OCs, please just keep in mind that my presentation is based on OCB medical department guideline. First, the objective of this session is to describe what's COVID as a disease. Of course, we need to know how to do our isolation and how to do our transmission-based precaution, and what's the recommended PPE based on current evidence on SARS-CoV-2 and the type of activity we are following. So what's COVID-19? COVID-19 is the name of coronavirus, novel coronavirus, which appeared in December 2019, early 2020. SARS-CoV-2 is the name of the virus that caused the COVID-19 disease, and this was declared as global pandemic by the WHO on the 11th of March 2020. Previously, coronavirus are seen in two types, as SARS, which has appeared in 2002 in China, and the transmission was through bats, and 8,000 people were infected, higher mortality, 774 died, and it was like 10% of the infectious cases. And this was in limited country. It was not pandemic, same as COVID-19. Also, we have the MERS-CoV, which is appeared in the Middle East and especially in the Gulf area, and this was caused by camel. It has appeared in 2012, and 1,200 people were infected, 447 died, and during MERS-CoV, we had a high mortality rate of 36%. So how is the transmission route of COVID-19 is happening? We have till now two main transmission route, which is a droplet route by the spread of droplet from positive cases, and there is also some possibility of airborne transmission, which was shown in few studies, and another on fecal-oral transmission, if as some virus was seen in the fecus of patient positive to COVID. Of course, vomit, as the droplet is contaminating the surfaces, so infected surfaces also can cause the infection, and this will be transmitted by touching this infected surfaces, followed by us touching our eyes, nose, and mouth. And as we know, we touch our face every 2 minutes, and 1/3 of this times is to our eyes, nose, and mouth, or the mucosa area. So what's our infection prevention and control along with COVID-19? So the purpose of IPC is to limit the human-to-human transmission. As we know, like COVID is human-to-human transmission right now, to reduce any secondary infection, and of course to prevent the transmission through amplification and super spreading events. So all this we need to maintain it in order to provide a good IPC measure. The initial things we should do is isolation and transmission-based precaution. Why we are choosing isolation? Isolation is chosen as the best because transmission is easier to control than the source or host. So we need to break the chain on the transmission route. As we know, we have a chain of infection which contains 6 elements. The first element is agent causing the disease, which here is SARS-CoV-2. This agent contaminates the human. The human is transmitting the disease sorry, through respiratory tract secretions, stools, and blood, which is still under investigation. While transmitting, will be through a droplet mode of transmission, a droplet contact, and sometimes it's airborne through aerosol procedure generation. And of course, this will be received through the upper respiratory tract by the eyes, the nose, and the mouth. And of course, we will have a vulnerable host or susceptible host, who's usually the other human in front of the infected person. It can be elderly, it can be having underlying comorbidity like cardiac disease, diabetes, or undergoing any cancer or chemotherapy treatment. So we need to know the basic concepts and which accompany the personal protective equipment. First, we need to quickly separate suspected from standard patient in successive steps. So as you see, each healthcare facility has done a screening area to screen and triage patient with respiratory and fever symptom, which goes with COVID symptoms. And of course, the testing. As you know, still we didn't implement the testing procedure in our MSF project. So screening and triage has been implemented through all MSF projects. We need to isolate the patient, either suspected or confirmed patient. It depends on the MOH requirement, like it is either in home-based or facility-based. Some of mild cases are requested by the Ministry of Health to do home isolation. Some they need admission into the hospital. So it depends on the regulation of the country. Of course, with positive cases, there is possibility of cohorting COVID patient, except if they have any other communicable disease. One of the important elements is specific engineering control, especially to improve the infrastructure by improving the ventilation, the natural ventilation or mechanical ventilation to control the flow of air and the distribution of air. In any COVID treatment center, we shouldn't use central AC. With isolation, we need to have specific rooms. So there is a room which required, for example, for suspected cases, single room is the most preferable room type to isolate this type of patient. Like a single patient per room, and if it is with its own toilet, it's perfect. We have also, like as I mentioned, the single rooms for the positive cases with its own toilet, as same as in one of our projects. And we have the cohort ward, which it's a space where we only cohort few patients with positive COVID and have the same organism. We have also the single room with negative pressure, which is air mechanical, pulled outside away from the entrance and door. And we need to apply airborne precaution. And this is not, we don't have it in our different MSF project. It's a very minimal project which having this negative pressure. For example, we have Bardias hospital here in Lebanon with negative pressure room. We need to ensure that when we are isolating cases, like they have the same organism, when to put it in cohort ward, and if, for example, they have a TB or other communicable disease, we will put it in single room. Now we'll talk about the transmission-based precaution. The transmission-based precaution is applied in addition to standard precaution that we need to treat all patients as infectious, and we need to prevent this transmission. This transmission-based precaution is designated for patients which are known or suspected to be infected with any infectious pathogen, and here's the case of COVID-19. So this additional control measure is just to prevent the transmission of this disease. We have two scenarios in transmission-based precaution for COVID-19. We have the scenario of suspected or confirmed cases with COVID-19. So here the precaution which we should adopt is contact precaution or plus droplet precaution. But any cases of suspected or confirmed COVID patients, aerosol generating procedure, for example, we are doing intubation or extubation for any patients which are severe ill or any suction procedure. So this will go as contact and airborne precaution. Our third part of the session will be like the personal protective equipment needed in a COVID treatment center. So what's the role of additional PPE? Of course, in a suspected area is to protect the staff and protect the patient from other pathogen. In confirmed area, the same. It's protecting staff from getting this infection from patient, and protecting patient from the healthcare associated infection and other germs. At least we need to ensure that we change our gloves and wash our hand or use alcohol hand rub between patients. And we need to make sure like there is a limitation with the use of PPE, like for example, the mask and the gown is protective until it's wet or torn or visibly dirty. So this cannot provide more protection for us. I will talk now about the different type of protective equipment which used in the COVID center. So first we'll start with the hair protection, use of shallot, and of course this is due to some study which has shown the possible survival of in the hair. And our hair is considered as high touch surfaces, so to protect ourselves from touching our hair. So we need not to touch our hair, and we need to wash our hand before and after touching. So I will start from the role. I think from here it's been disconnected. I will talk about the role of additional PPE, which mainly in suspected area is to protect both staff and patient. In confirmed area, we need to protect the staff from getting the infection and protecting the patient from getting any health care associated infection or other germs. We need at least to change the gloves and perform hand washing or hand rubbing using alcohol hand rub between patients. And of course, the PPE has its own limitations. So, for example, if a mask is wet or torn or visibly dirty, it cannot provide the proper protection which we are looking for in personal protective equipment. First, I will talk about the hair protection, and the recent study has shown the possible survival of SARS-CoV-2 in the hair, and our hair is considered a high-touch surfaces. For that, it's better to use the Charlotte to cover our hair. So this will provide a non-touching to our hair, and in case if we touch, we need to wash our hand, and of course, before performing before wearing the Charlotte, we need to perform our hand hygiene. Eye protection is very essential part of personal protective equipment, and it consists on goggles and face shield, but the most recommended in case of positive or suspected cases of COVID is face shield, which shown is similar to the one in the picture. So why we are using this to protect us from droplet projection and to protect us from splashes. Who can use this two type of eye protection? Any healthcare worker in close contact, as I mentioned, with positive or suspected cases, and this is also for cleaner, hygiene agent, and laundry staff to avoid splashes from fluid while they are cleaning or while they are washing linen, and from droplet. Of course, we shouldn't touch, and we need to wash our hand before and after touch. Surgical, now we'll talk about the mask. So we have the two type of mask. We have the surgical mask and we have the N95 mask. And each one has some specification, and we need to know for whom and for how long and how we can use it. So the surgical mask is offered if we have enough quantity for symptomatic patient who comes with respiratory symptom like cough along with fever, and of course for healthcare worker when they are not dealing with COVID positive or suspected patient. And in case healthcare worker is dealing with any COVID patient, he need to maintain a physical distance, which at least 2 meters between himself and the patient. Of course, we need to ensure that the surgical mask is fitting properly and covering from our nose up to our chin with adjustment of the small metallic part, which on the upper side. We can use it up to between 3 to 6 hours until it's wet. Maybe it gets wet from our breath or while we are talking, or when it's visibly dirty or torn, we need to change it. Also, we need to change it if we have difficulty of breathing through the surgical mask. N95 is a higher protection, and it gives 95% like particle, like he reduced the number of particles. It's more safer, and he provide a 95% protection from viruses or bacteria. So this is for healthcare worker, clinical staff, doctors, nurses, and also cleaners. So any staff who's dealing with suspected or confirmed cases, he need to use it also when we are dealing with pediatric patient and internal medicine patient in an area where we have a high level of local transmission. And of course, we need to prioritize the healthcare worker while they are doing aerosol producing procedures. We can use it for 8 hours, either continuous use or intermittent use during the same day. And this type of mask now with passive decontamination, which I will talk about it later in the webinar. We can use it with passive decontamination up to 5 times. Of course, we need to keep it until it's wet, or if it's wet or visibly dirty or torn, we need to discard it immediately in the waste. Of course, after any aerosol procedure, producing procedure, we need to discard the N95 and not to keep it for later on. Also, hand protection is one of the essential. As we mentioned, this is contact transmission, but gloves can give a false sense of security. So sometimes we feel like oh, we are safe while wearing gloves, but we need to be careful because gloves also cannot protect us, and we touch gloves and we touch many things. So we need to have common sense with using gloves for everywhere. We have two types of gloves. We have the examination gloves, which disposable gloves for, and this is used by mainly clinical staff or any staff who have direct contact with patients. While the reusable gloves or protective gloves is used by cleaners, hygiene agents, and laundry staff. Of course, there is some requirement. We shouldn't have any jewelry up to the elbow. We need to wash our hand before putting our gloves and after taking them off. And in the case of COVID, and especially in the case of, like, for example, I will give the example of cleaner or the laundry staff, no need for double gloving, only the use of reusable gloves is enough. The body protection is, or the overall body protection. This is essential, but before this, we need to ensure like the staff is wearing their working clothes, from scrub suit to clocks, boots. So this will be first. Then it comes body protection. And this is mainly to protect the healthcare worker in contact with patient from droplet or from any contact with contaminated surfaces. And this is mainly for surgical gown. We have the coverall, and this will be used by cleaners or laundry staff as they are at high exposure for splashes while cleaning or while washing dirty linen. And this coverall also will be used by the clinical staff if they are dealing with patients who have severe diarrhea or vomiting. We have finally the light isolation gown, which can be used in some area for clinical staff, for example, in screening area, with respect of physical distancing. And this is also for caregiver who's accompanying their, if they have a child or elderly or disabled, to protect them from contaminated surfaces. Of course, before all this, we should know the sequence of donning and doffing of personal protective equipment. So staff, when they arrive and change into their working clothes, they will proceed to the donning area, and they will start donning their personal protective equipment. There is a specific sequence for this personal protective equipment, as you can see in the picture here. This leaflet will be posted in all donning area in order to remind staff on the proper sequence of donning and doffing. We need to prepare our personal protective equipment according to the area where we are going to work, and we need to check our personal protective equipment. If it's damaged, even if not used, we need to check for damage or any torn available before start doing it. The first step, of course, we need to do our hand washing, and this is essential before any PPE donning. And we'll start with wearing the gown or the coverall, in the case of coverall, and it's followed by wearing, for example, the mask, surgical mask or N95 mask, then the eye protection, and the final step will end up by wearing the gloves. This is the sequence of donning. While the sequence of doffing, it's completely different. So at some point, if we are doffing our PPE for final doffing as we are going home and we are removing our PPE finally, so we can remove at the same time the gown along with the gloves at one time, but this is not the case if we are still on duty and we need to remove our gown to go to eat, and this is the same for all different PPE. For example, we are going to eat or to go to use the toilet, we need to remove PPE. So there is, initially we should remove the gloves first, then the gown in a way, and hang it for reusing after lunch or after using the toilets. And the same will be for the mask, where we will place it in a specific box to store it for that time and rewear it. So we'll start first, like as I said, with gloves, then gown, and of course between each step we need to perform our hand hygiene. Then we will go to our eye protection, we'll remove it, then to the mask, regardless if it is a surgical mask or N95 mask. And please ensure while you are removing the mask to untie or remove the lower length or elastic band first, and later you remove the upper one, and of course perform hand hygiene after. If we are using N95 mask, we need to perform particular respirator seal check, which is very important, as N95 cannot provide proper protection if we don't perform the seal test. We have different shape of N95, of course, but the same seal test is applicable for the different types. So we need to ensure that we adjust, we wear the mask, we adjust it properly on our nose, and then we will cup our hand on top of the mask, we'll inhale and exhale. If we are, while we are exhaling, we can feel air is coming out under the eyes in this area or below the chin, that means we don't have a proper seal of N95. We need to adjust it. Maybe we will adjust the nose piece, we will adjust the elastic band and perform the seal check again. If again we have a failed seal check, that means maybe this size or this model doesn't fit you. Please inform the person in charge for infection prevention and control in your project that you don't have a proper seal test with this. Maybe he will get you different size, different model, but you need to alert people. Of course, as COVID-19 is now pandemic and it's worldwide, we are facing a shortage of personal protective equipment, and now mainly with surgical mask or N95 mask. So we need to know how we will deal with it. As MSF, we worked on some mitigation measure to ensure that we have alternative for any shortage. So our mitigation strategy was by reducing the PPE consumption by rational use, only where, when, and how it's recommended. So for each staff and where he works, there is a specific type of personal protective equipment. Of course, we need to train the staff, provide them the methods how to don and doff PPE, and they will be supervised for while donning and doffing till they feel comfortable. Of course, we need to reduce the numbers of users. In some projects, we are limiting staff who's dealing with patient or cases, and it's according to the shift provided by the PMR or by the NAM. We are using the extended use, which is tips on extended use or reuse of single-use item. For example, mask is one of single-use items. Of course, now we are trying to adopt and explore the option of single-use PPE decontamination. And the last option is the local manufacturing of PPE, especially like, for example, for the face shield and for some clothes mask or reusable gown. I will talk now about reusing of the mask, regardless it is surgical mask or N95. The important things in this is to be used by the same user. If this mask is used, for example, by Rula will be using this mask and reuse this mask, and this condition apply by writing my name on the mask and the container where I'm going to store my mask. I shouldn't store it in an area close to the patient, so I need to choose an area where it's safe and I can store it properly. I need to do the fit test each time, and if the fit test or the seal test is failing, so that's mean I should discard this mask. If it's wet or I should discard it. If not wet, then I can reuse it. Of course, like if difficult to breathe or visibly dirty, I should discard the mask. And the other condition that I will discard the mask immediately is when I'm performing an aerosol procedure, aerosol producing procedure, so I should discard it immediately. Of course, before removing and after storing, before putting it back and after putting it back, I should perform the hand hygiene, either by hand washing or by use of alcohol hand rub. How to store the mask? For FFP2 or N95 respirator, we have two options. So option one, if I'm removing this mask to reuse it after a while, like for example, I want to drink, to have my coffee break or my lunch break. So I will remove it and hang it on the hanger, and I will ensure that my mask is already with my name. As you can see, like this type of hanger, for example, I'm Lisa and I hang my mask where it should be on, with my name. The option two, I should store it in a ventilated or breathable container, which evacuate humidity. So one of this can be a paper bag or a carton box, or even we can use a plastic container with small holes which allow the ventilation of air. As you see on this carton box, there is a name and there is a date. If I'm going to store my mask on the same day in this box, I will put my name. And I can put I can put the date. And this will help me for the passive decontamination, because putting the date is allowing me to know how many times I can use it as passive decontamination, and this is, I will come to explain it in a while. Also, surgical masks can be reused and have, as we said, extended use up to 6 hours. And reused, like for example, I want to remove it to have my coffee or to go to toilet. So I need to fold it this way from the white side, from the clean side, which comes in contact with my face. Fold it in a way and keep it inside an envelope. Or we can use again the same as previous one, the hanger. And the same, we can use the same method of putting in paper envelope for passive decontamination. The hanger is only to be used either for surgical mask or N95 for the same day reuse, but this is we cannot leave like N95 or surgical mask on the hanger for 7 days for the other time to be used. There is the third alternative, but this is mainly for patient or community people, the linen mask, which done by locally manufacturer. And this has some specification. It consists of 3 layers, 2 outside the layer and 1 inner pocket to insert a filter. As I said, this is for patient use and for community where we have, for example, like IDP, prisons, a lot of people, congested area with people. So we can use linen mask. And the linen mask will be the last resource, and I'm insisting on last resource, to be used by healthcare worker in case we don't have any type of surgical mask or N95 alternative. Of course, to mitigate, one of the mitigation method, we have the decontamination of respirator. A lot of studies, and we are looking on different methods and options which we have. So one of the options was the use of UV light, which is not the same as it's used in any TB ward. So this is a specific machine for decontamination of respirator or for surgical mask, which now we are, it's under process of doing for both masks. We have also the sterilization with hydrogen peroxide, which some study has shown efficacy of hydrogen peroxide on the decontamination of respirator, which is the N95. And as I said, we have the passive decontamination, and the passive decontamination consists of, like, I used my mask, and at the end of the day, I will remove my mask safely. I will remove it, and I will place it in the breathable container with my name and date on it. And this mask can be reused after 7 days. N95 mask can be reused with this passive decontamination up to 5 times. That means almost 1 whole month, but with 7 days difference between each time. So whenever I'm having this, I'm removing my N95, I put it, today is 13th of May, I will write Rula 13th of May. Then next week on the 21st of May, I need to wear it. Again, I wear it on 21st of May and I remove it. I will put the date again on that one. And the 5th time after removing, I should discard it. As we find alternative for mask, we have alternative of gown, and we need to have the reusing of gown. For example, for single-use gown, at some point on the same day, we can reuse this gown. If I'm going to go to toilet, I will remove my gown and I will hang it in a way like the inner part is towards me when I'm going to rewear it again. And this gown, as I said, this is reusable gown, can be on the same day for disposable, but at some point if we run short with this disposable and we are out of stock, we will use the reusable gown, which is washable material. And this is if the stock is completely out. We need to provide enough quantity for staff, like each staff will have 2 to 3 gowns per shift. And these gowns will go through the hospital laundry process. Also, gown will be provided for caregiver, and they need to hand it over into the healthcare facility while leaving. And of course, this can be used for people who's performing home-based care or who's assisting nursing care in a senior home. And the same, it will follow the hospital laundry protocol. Face shield also is we can have alternative, which is local manufacturing or homemade single-use, but actually we are looking mainly into the reusable type, the 3D printed face shield, and we made some specification for it when we want to do it locally. It should be easy to wash, to disinfect, and it shouldn't have any metallic part, and we need to ensure that it covers the full face from the head, from the overhead until the chin, and to ensure like the proper coverage of the face from both sides, like it covers and protects us from both sides. As we develop guideline and people like they feel difficulty or they have difficulty to access the guideline through the SharePoint, which like mainly the PMR or the Medco have access. We have developed guideline for personal protective equipment for different category in a healthcare facility and with different scenario, like for example, as you can see here in the screen in this table, we have PPE, which will be used in a scenario from 1 to 3, where in this scenario, the MSF, there is in the country some infection with COVID-19, but it's not within MSF catchment area. And I will take the example like in the screening area, the personnel who's performing the screening can wear a surgical mask with the light disposable gown, or what we call as isolation gown. And he need to maintain physical distancing of 1.5 meter to 2 meter. And I would recommend at least 2 meter if possible. And of course, if he's going to touch the patient, he need to wear gloves. At some point, the laboratory in this scenario, he will wear, maybe he can wear the Charlotte, the head cover, face shield, and his lab coat. And of course, as he's in laboratory, he's mandated to wear his gloves while dealing with the specimen. Of course, at some point, like we need to look into the patient. If a patient is presenting to our facility with cough, so we will offer her surgical mask if it's available. If it's not available, we will offer the patient with cloth mask. Many of our projects are performing home-based visit. In this scenario, they will use either face shield and goggles along with N95, and of course, either surgical gown or coverall. It depends on the situation of patient. Coverall can be used by healthcare clinical staff if they are exposed to any patient with severe vomiting or diarrhea. Along with scenario 1 to 3, we put PPE for scenario 4 and 5, where we have positive cases in the catchment area of MSF project. And again, like we will have, for example, in standard consultation, we will have the Charlotte or the hood, the face protection, either face shield or goggles, the N95 or the FFP2 respirator, a surgical gown, and of course, a gloves. Cleaners, all cleaners in any level 3 or scenario 4 to 5, when we are having patients in the MSF catchment area, or as MSF is a treatment center for COVID-19, all cleaners need to wear hoods, face shield, and N95, along with coverall and protective gloves. The coverall is mandated for cleaner as it protects them from splashes. They are more prone into splashes while cleaning the environment of the patient. Laundry staff are the same. They need to wear coverall, protective equipment, but the type of mask will differ. Here it's a surgical mask because they don't deal with, they don't go into patient room. They deal only with the linen in the laundry, but they need to wear face shield. And the cleaner and laundry staff, we are highly recommending the use of face shield for them. For kitchen staff in a COVID-19 area, they need to have their face shield or goggles protection, surgical mask, of course, working clothes with apron, protective gloves, especially if they are processing dishes or cutlery from COVID-19 patients. As you can see, this table is giving for different type of scenarios and for different category of staff, the type of PPE required in their area. I prefer that you ask your PMR or Medco to print out this 2 slides for you and laminate it and put it in your dining area. This will ease for you, and you will not have like doubt about what I should wear in this situation, what I will not wear. So this is a clear picture for different type of stuff. As I said at the beginning, like OCB guideline differs from other OC's guideline if other OC staff is watching us. So for us, we are recommending for clinical staff and for cleaner in COVID-19 treatment center to wear N95 when dealing with suspected and confirmed cases, along if they are performing aerosol producing procedure. So just I want to highlight this because maybe if other OC staff is watching, so this is one part which we mainly differ with other OC. And thank you.